First aid. It's a crucial skill that everyone should know. Whether you're at home, at work, or out in nature, knowing how to provide immediate assistance can make a world of difference. It's the first line of help when someone gets hurt. Imagine you're hiking and someone in your group twists an ankle or gets a deep cut. Your ability to act quickly and correctly can prevent further injury and even save a life. It can be the difference between a quick recovery and a serious problem. But there's a problem. Many people are misinformed about what to do in these situations. There are a lot of myths about first aid. These myths are dangerous. They can lead to actions that might worsen the situation instead of helping. They can actually make things worse. For example, applying butter to a burn or trying to make someone vomit after they've ingested poison are common misconceptions that can cause more harm than good. We need to know the truth. Accurate knowledge is essential. Proper first aid training can dispel these myths and equip you with the right techniques. We need to be ready to help the right way. This means staying updated with the latest first aid practices and guidelines. Knowing the right first aid can save lives. It can prevent long-term injuries and complications. It can prevent long-term injuries. Moreover, it can give you the confidence to act decisively in an emergency. It can give you confidence in an emergency. But with so much information out there, it's easy to get confused. Some common practices we've seen in movies or heard from family members are actually wrong. That's why we're here to debunk some common first aid myths. We'll give you the facts based on science and expert advice. Get ready to separate fact from fiction and become a first aid hero. With the right knowledge, you can make a real difference. Let's dive into some popular first aid myths. These myths have been passed down through generations, often believed without question, but how many of them are actually true? Today, we're going to debunk some of the most common first aid misconceptions and provide you with the correct information. These are the ones we've all heard before, but are they true? Let's find out. It's important to know the facts because in an emergency, the right knowledge can make all the difference. Myth 1. Tilt your head back during a nosebleed. This is a common piece of advice that many people follow without thinking twice. Many people believe this helps stop the bleeding. They think that by tilting the head back, the blood will stay in the nose and not make a mess. Wrong. It can actually send blood down your throat, which is dangerous. This can lead to choking or even vomiting, which is definitely not what you want during a nosebleed. Myth 2. Suck the venom out of a snake bite. This seems logical, right? After all, movies and TV shows often depict this as the go-to solution. Nope, it doesn't work and can even introduce bacteria into the wound. Scary. Instead, you should keep the affected limb still and seek medical help immediately. Myth 3. Put butter on a burn. This is another old piece of advice that has been around for ages. Sounds like an old wives' tale, and it is. People used to believe that butter would soothe the burn and help it heal faster. Butter traps heat, making the burn worse. Ouch! Instead, run cool water over the burn and cover it with a clean, dry cloth. Always remember, proper first aid can prevent further injury and promote faster healing. Now that we've busted those myths, it's time to focus on what you should actually do in these situations. What should you do instead? Let's dive into the correct first aid practices that can make a real difference. Here's the truth about handling these situations effectively and safely. Nosebleed? Pinch the soft part of your nose just below the bony bridge. Lean forward to prevent swallowing blood and apply a cold compress to the bridge of your nose. This helps stop the bleeding safely. Snakebite? Stay calm, immobilize the affected area to slow the spread of venom and get medical help immediately. Time is crucial here. The faster you get help, the better the outcome. Burn? Cool the burn with cool, not ice-cold water for 10 to 20 minutes to reduce pain and swelling. Then cover it loosely with a sterile bandage to protect the area. Avoid using ice or butter as they can cause more damage. Remember, these are just a few examples of proper first aid techniques. There are many more first aid myths out there, so always make sure to verify your information from reliable sources. First aid is all about being prepared. It's about knowing what to do when every second counts. By separating myth from fact, you can be confident in your ability to help. Don't rely on outdated information or hearsay. Seek out credible sources like the American Red Cross, the Mayo Clinic, or your doctor. Take a first aid course. It's an investment in your safety and the safety of those around you. Be a mythbuster. Be informed and be prepared to save the day.